on a snow day at 8 years old, on the second or third snow day, a hyperactive kid, my mom begged my dad to please just get him out of the house, take him to work. And it took me about 5-10 minutes to wear out the front desk person, another 20-30 minutes to wear out the clinical staff who had to go see patients. And I found myself wandering around this old house of a dental office. And because it was an old house, the rooms were very small. The head of the patient was at the end of the room, almost in the hallway, and I could just lift up a little bit from the hallway and see what was going on, and suddenly found myself observing surgery at the age of 8 years old. I was like, that's pretty cool. And between 8 and 12 or 13, went back and visited the office several days, and was sort of had my mindset, this is something I'm really interested in. As a teenager, I decided I need some distance and sort of put it to the side a little bit. And I woke up in January, my second year at University of Vermont. In January, my second year at University of Vermont, I woke up one morning and said, I think I want to go to dental school. And then just regrouped and focused on the application process and starting dental school. I finished my residency in 1997 and worked in my dad's group in Swampscott. And March 1st, 1999, I took over Marilyn Canis' practice here in Boston, who coincidentally started here in Center Plaza in 1978 or 77 before she opened at 180 Cambridge Street in 1979. And this was a very small periodontal practice. She didn't do any dental implants, so it was extremely limited. And the demographics of dentistry have really changed from 1999 to 2015, when by that time, I realized we had to change. As a periodontal practice in 2005, about 75% of my referrals were direct from dentists. By 2015, that had inverted. It was probably below 25%. So by that time, I was realizing that by where we are now, 2025, I'd have to be thinking about changing my practice for the future. And I had met Dr. Julie Mitchell in about 2014 or so, and we had talked a lot about possibly trying to have some combination of practice together. And July 1st, 2018, Julie contacted me and said, I think I'm ready. And I contacted her back and said, I'm ready. And 8 weeks later, September 1st, she started working in the practice, and we quickly realized that the evolution was to bring in other specialists. And it took time and process and a little bit of trial and error to find the right team members. And now we service periodontics with dental implants, prosthodontics, endodontics, orthodontics, and oral surgery. And it's an amazing team of people. And it's unique because every practice in Boston has different specialists in the practice, but they work in silos. They're general dentistry based. There's really only a few practices in the United States that are purely specialist based, multi-specialty, where you can go in and see multiple specialists, the same visit in the same chair, and it's seamless and it's unique, and it's been very successful, and we're really excited about it, and we're excited to continue to grow and provide the care we provide. We have a very enthusiastic, committed, compassionate, empathetic team of people. It's equivalence between being the right type of a human being in person who has the high level of compassion and empathy equivalent to being at the highest level of care that they can provide, world-class care for patients. So it's both. It has to be someone that cares about people and can be working as a team with other people and committed to that. It has to be someone that is passionate about dentistry and passionate about people and is in this for more than themselves. And we've been able to find an incredible group of people. We sort of started from scratch when COVID came. We sort of took the opportunity. I tried to manage people for 20 years and done all kinds of different programs, and finally realized that you needed the right group of people that were truly committed. And so we started from scratch, and it took about 2 years to build the foundation of the team. And we've done very well, and for the most part, we've been pretty disciplined. There's always bumps in the road, and we've learned from those and tried to stay with our discipline of being committed to not making exceptions, that everyone has to be on board. Yeah, it probably took me a day or a week when I began my residency at Harvard to identify a unique academic environment, clinical environment, style of teaching. And it really fosters a strong, independent exploration of finding the right answers. It's not a dogmatic type of clinical program where you're told everything should be done a certain way. And it's a peer-to-peer teaching model. It's not a up and down model or a bureaucratic model like many dental schools. And it's really, one of my mentors was Ray Williams, who I fortunately and unfortunately didn't have the chance to really develop under clinically. I think Harvard was known as being a very research-oriented periodontal program, and when Ray left, when I came there to go to school, I started July 1st, he left August 1st. It opened up for a little bit of change to make the program a little more balanced between clinical and research. But Ray's famous for having this broad base of students that trained under him, moving on to go past him and become deans of schools all over the country and leaders in periodontology. He's known for springboarding his previous students to become leaders in periodontics and dentistry. Many of them become deans all over the country or the world. So the teaching environment at Harvard is looking to push people as far as they can go. And the chairman, the program directors, the whole faculty want to see people be able to develop into independent thinkers that can become leaders and great clinicians. And I don't know, the people that I have here are uniquely great people who are committed to excellence, committed to care for their patients, and I trust them. I know that they're here to do the best they can for patients, and that's their primary motive. And they care about what they're doing, and they care about the team members, and that's what I want.